A stroke can be a life-changing event, and that was certainly the case for a Shreveport man. He's relearning how to walk, talk, and play golf.
Golf has been a large part of Adam Manuel's life. He started playing at the young age of 3, and the sport he loves has taken him many places, including playing for LSU, serving as the golf pro instructor at a country club, and his highest accolade was in the Gulf States Assistant PGA, where he was a champion in 2022. 3 weeks ago, Manuel was at work and says he was all of a sudden disoriented, confused, and slurring his words.
I ended up coming to find out I had a stroke. It was a shock. I never knew that anything was going on.
Manuel was in the ICU for 4 days, then was transferred to Encompass Inpatient Rehab for therapy.
It's working wonders because I couldn't walk, couldn't talk. Now I have movement in my arm a little bit. Got full movement in my right leg and left leg.
Since his stroke, Manuel has participated in physical therapy, occupational therapy, and speech therapy to help him get back to where he was. Manuel said the hardest part of this process is knowing it will be a long road to recovery and getting back to playing the sport he loves.
It's almost like I feel like I'm blind, I started swinging. I didn't know what was going to happen. It's very humbling.
Manuel will begin outpatient therapy after leaving the rehab facility, and when asked if he was ready to get back out on the golf course, he said,
100%. Can't wait. Can't wait.
A stroke is a medical emergency, and it's a result of damage to the brain from an interruption of its blood supply. Symptoms include trouble walking, speaking, and understanding with paralysis of the face, arm, or leg. If you or someone around you is having a stroke, call 911 immediately.
Encompass Health Rehabilitation Hospital is celebrating their 3rd anniversary in Shreveport this month. While Encompass can take care of anyone at any age, they typically see patients recovering from physical trauma like a gunshot wound, strokes, amputees, hip fractures, or any type of debility that requires inpatient rehab where patients can work to get their activities of daily living restored. Chris Phillips is the Chief Executive Officer at Encompass Health.
When people think of rehab, the first thought is like drug rehab, but this is inpatient rehab. The minimum requirements is 3 hours of therapy 5 days a week. 3 therapies are physical therapy, occupational therapy, and speech therapy.
Encompass Health's main focus is on intensive therapy, especially after a major event like a stroke that affects a patient both neurologically and physically. Immediately implementing some kind of therapy like occupational therapy right after the event can help a patient recover much faster.